Welcome back to East Texas Live on KETK. Well, CHRISTUS Trinity Mother Francis is recognizing Breast Cancer Awareness Month and also the services they offer. So here to tell us more is Ronna with the Ross Breast Center. Welcome, Ronna.
Thank you.
Good to see you again.
Good to see you.
Okay, so first off, let's talk with this new genetic testing, because this is something I don't think we've hit on before.
Okay, we are offering genetic screening for patients that are high risk with a positive family history for breast cancer. So what you do is you come in, we identify you as high risk based on your family history as well as your personal history. And then we're able to offer you to talk to a genetic counselor via telemedicine.
Okay.
So via the telephone, you'll talk to a genetic counselor. They'll create a family pedigree, and then you will be sent down for blood testing to test for 28 genes.
Wow.
To see what your breast cancer risk, your personal breast cancer risk is.
So were they taking blood, or how does that work?
We do it with blood. It can be blood or saliva, and so it is. It's a really easy test, and it can personalize your screening so that we can hopefully prevent the development of cancer in the future.
Well, I feel like this is obviously crucial for people who know they have a family history, but what if people don't know? I mean, they have no clue. Is it still just a good idea to get done, or?
Right. Right now, insurances don't cover that. If it's just something that you want, we can offer it at. We have different cash pricing that we offer through the lab. Especially if you're adopted or you don't know your family history, a lot of times then they can offer you different testing to make sure that you're not at risk.
Yeah. Okay, and another thing, obviously, mammograms.
Right.
That's the big one. So how often should everyone be getting mammograms?
Everyone should be getting mammograms annually after the age of 40. So at 40, you start getting annual mammograms. Sometimes, depending on the density of your breast, which is identified by the radiologist, you may need a screening sonogram too, an ultrasound, to make sure that we look at all the breast tissue so that we can prevent breast cancer. Yeah,
well, and obviously those mammograms are important, but the self-breast exams are just as important as well.
Yes, self-breast exam should be done every month. Every woman should do that every single month, and that way you know your breast tissue. If a doctor examines you and feels something that you've felt for several months, you know your breast tissue. So any lump should be examined by a doctor and then ultimately imaging so that we know what happened.
And I wonder too with guys, because the reality is that males can get this. So what options, I guess, are there for them? For them,
self-exams. Self-exams are crucial. If you find a lump, it needs to be investigated. It needs to be examined by the physician and by a radiologist. And so guys do get breast cancer. And so if you feel a lump, have it examined. Don't be shy. Don't wait.
Yeah, exactly. Well, and real quick, let's just talk about the Ross Breast Center in general. You guys have some pretty great services for people who are going through breast cancer.
Right. We have screening sites. We have several different screening sites. We have the Ross mammography bus, and so it goes to many different sites around East Texas, even if there's not a mammography site in your town. So we can always look for that. And then at the Ross Breast Center, the Houston, the main location, we offer diagnostic testing to include mammograms, ultrasounds, the genetic testing, as well as breast MRI through the hospital.
And I want to mention really quick, we're about to run out of time. You guys also help people who are going through chemo lose their hair, fitting for wigs.
Right. Well, the wigs, we work with the American Cancer Society. They have a great program. And then we offer, it's called Thrive. It is a boutique for survivors that offer breast bras and prosthesis for patients who have had breast surgery.
Okay, a lot of good information. Thank you so much, Ronna. Good to see you.
Good to see you.